guys, welcome to KV General channel. To my subscribers, thanks for subscribing. I think we just left with around 110 or 100 to just get to 1,000 of subscribers. So as you can see, I'm just outside. We enjoy the campus because of this, fresh air, fresh breeze, good atmosphere. So the reason about this video was it's a late video. It should have been out. It's about 4th years. Welcoming you guys to 4th years, those that are doing 4th year, and also those that are still going to do 4th years in Sefako Makgatho at University. So it's still going to be beneficial. Even if you are first year now, you're going to do 4th year in 3 years to come, it's still going to be beneficial. So usually you have around 6 subjects there in 4th year, if I'm not mistaken, but you can just count them. So you have forensic medicine, you got community health, you have your path, and you have your pharmacology, then you have practice of medicine. So if I forgot any of them, please let me know, because I think I did forensic, I did community health, public health, I did path, I did pharmacology, and I did practice of medicine. So like I said, practice of medicine, you're going to find it everywhere you go. So I think we'll finish with practice of medicine. I think we should start with it. I don't know, but let's do this. So with community health, you start with the easy ones. With community health, guys, it's just about, like, it's general knowledge. You read that thing like you're reading a question paper, a newspaper. So it's easier to go around with it. That one, you don't need a textbook, you know that. So I won't touch on that community health. You just read those slides, those documents, like, perusing. It's something that you can apply yourself, the knowledge. And then we have forensic medicine. So forensic medicine is a bit of studying, but I'm not sure if they've changed the question papers thus far, but usually we used to do the previous question papers, and you get 80s, 90s. Sometimes just like we feel bad, we don't want to get 100, so we just to get an 80 there, just miss some things. But you need to study it. It's an easier thing. And those who are doing combined block, when you go that side, it's going to be easy. But it's a little bit of studying with that. But with the question papers, it helps a lot. Those question papers, they repeat a lot. So I'll emphasize again, you don't need a book for that. Then we go to pharmacology. Pharmacology in 4th year, it's a bit tricky because it's different from 3rd year. So again, you don't really need a book, but you can buy one because you're going to need it in future. It's a South African medical. It's a green book. Yes, they call it SAMF, so you can get that one. It's tricky. It chows. It's only 3 tests. So if you're not good, it can put you to halt. So just make sure that you get to manage. Just be careful about it. Even though it's not troublesome. It's just that it's 3 tests. So if you make a mistake with 1 test, you make a mistake again with a 2nd test, or you just get a 50. Then the 3rd test, you have to work hard. So I think it's more of application. So make sure that you are careful about pharmacology. And path is all or none. If you don't know, you don't know. If you know, you know. So it's more of application. More of you cannot read it and not understand. Like the questions that come there will be like, this is the patient, this the bloods that were, how do you manage this? How do you correct this? Acid base, this is the blood gas, arterial blood gas. What's wrong? Is it a metabolic acidosis? You need to be able to find those things, So if you cannot apply, you're going to have problem with path, because you need to read to understand. It's more of like a physiology, like you need to know what's going on. You cannot just read and say, I read this like anatomy, I'm going to regurgitate. No, you need to be able to apply. That's path. So I think the most tricky things between these 4 that I mentioned now, it's path and pharmacology. So I was shaking a bit when I started my path, but I managed, because I realized that it's not something that you can just cram, and you need to understand, because the questions that are going to come are going to be like an application, So then you go to, you don't need a book for that too. The slides are enough. So that's why you only need the book for that, for pharmacology. Then when you go down to practice of medicine, practice of medicine, there we have all the 6 blocks. You got surgery, you got internal medicine, you got peds, you got ops and gynae, you got psychiatry, and the last one is combined. So you know that you got this. So combined, you know, you guys are there, you're going to do forensic medicine, you're going to do neurosurgery in combined, you're going to do family medicine in combined. So you don't need a book in combined, you just need to listen to the lecturers, get the slides. Forensic, it's like you need to just attendance, you know. So I know it's difficult to see like a dead person performing an autopsy, so you just have to be ready with that, because seeing someone autopsy, it's a bit difficult, you know. So you just need to be ready about that. The exam is a bit tricky because it's a long exam. It's very long. We've got a lot of stations, around 23 stations, so you need to know your work. Yeah, but the slides are enough. You'll pass. Let's go to which one? Okay, psych. Psych. If you're doing psych, the only book that you don't need to buy a physical book. The only book that you need, it's the what you call this, is the introduction and also a DSM-5. But again, with the DSM-5, those books they're soft copies, so you don't have to go buy a book. You use introduction to psychiatry so that you understand some parts. Those parts are the ones that you need to understand. Just to like mood disorders, psychotic disorders, those are only things that you need to know, but you need to read them, you know. Then you go, when you want to the criteria you need to go to DSM-5, and those books are soft copies, you don't have to buy them, you can read from there. And also you need a psych summary. There's something called psych summary. So if you know, like I always say, make sure that you have a fifth year. If you're doing fourth year, you could have final year if you're doing fifth year, so that they sort of give you every information that you need, you know. So that's what you need. So you don't need to buy a book. All books are soft copies for psychiatry. So you're going to clerk a patient, learn to know how to clerk the patient, get the seniors who are going to be clerking with the seniors. You know, you might take 3 days just to clerk one patient of psychiatry. You know, they're going to be, you know, deranging there, going there, circumstantiality, tangibility, and all those things. Like you ask a simple question, they're going to go to Joburg, then Cape Town, then come to you. So just be patient and get to learn how to ask questions. The exam is easy. It's easy. So if you know those things, you're going to be good. It's going to be fine. Just read, know your stuff, mood disorders, and also psychotic disorders. Mostly those ones. If you know those ones, I'll guarantee you 50%. So we go to after that. Okay, let's go to internal medicine. Internal medicine, it's tough. It takes time. Needs you to read a lot of things that happens there, from endocrine to down to to seniors, CNS, GIT, you know, CVS. So it's a little bit tricky, but they make it easy for you guys. So the only book that you need there, it's 2 books. You need clinical examination, Italian corner. You also need Davidson or Combined Clark. You need those 2 books. So that's why with poem you need the soft copies. The physical copies that you need. It's that Kuma and clinical examination, and you find that you have bought it already during the junior years. It's tough. It's tough. It's a bit tough because there are a lot of things. But again, just master the basics and master the easy systems like CNS, CVS, and GIT. They will bring you some rheumatoid arthritis, and also master DKA, some bit of endocrine, so DKA there. So you'll be good with that. And then you go to PEDS. So with PEDS, again, it's an introduction, guys. These guys are lenient with you. They won't go hard on you guys. So with PEDS, you need Covardia, that green book, Pediatrics Covardia. So again, it's an introduction with that. Just master the basics. You know, they're going to be telling you about the charts, the Z-scores, immunization, you know. Examination, again, they won't bring serious, deep things. The examination, internal medicine and PEDS, they're not that different, you know, in terms of the structure. Just at that time that side you're dealing with pediatrics, that side it's like adults. So again, CNS, CVS, GIT, and respiratory. I forgot respiratory in internal medicine. So those systems, you make sure that you master them. Then the most important thing there in PEDS, it's systems like nutrition, because we've got a lot of severe acute malnutrition here in South Africa. So those are the conditions that you need to know. But in terms of the exam, again, it's not, if you do your work, let me say, from 4th year, if you study, you do your work, you will pass. Especially, I'm talking about practice of medicine. If you do your work, you study, you might not even need question papers. You pass. I guarantee you pass. Just your knowledge. When you go to Obs and Gyne, the same thing. You only need Introduction to Obstetrics South Africa. That book, you need to get it. So if you read and you do your work, you are going to pass, guys. Because I think mostly a lot of you guys want to pass. So if you do your thing, you can pass. There isn't much in obstetrics. You're just doing that, not gynae, but it's a bit, gynae is also part of it. So, but if you do your work, I'm guaranteeing you, if you want to get distinctions cum laude, then you have to go an extra mile. You need to go an extra mile. And I believe it shouldn't be your first. So you've been doing that from the third year. So you know what to do to get to that. And the condition that they bring, it's easy things, it's easy things. They're going to teach you about labor, steps of labor, active, what. So it's easy things. It's easy things that you're going to do in fourth year. But the most important thing is, like, if you do your work from fourth year going upwards, without any question paper, without anything, I guarantee you a pass. And then now we go to surgery. Surgery also, they won't be hard on you. Surgery, you need a book, you don't need a book. I didn't have books in surgery. I use slides. So again, they're going to bring peripheral vascular diseases. They're going to bring you maybe a DKA there. They can bring a DKA there. Or maybe food sepsis, let me say, diabetic food sepsis. They can bring you just a breast, introduction. So breast, they won't go, and a little bit of GIT there, peptic ulcer diseases, So there isn't really much in terms of textbook that you need to buy. Slides are enough, and if you attend, you're going to be good. And when you go to, what's the last one? Ortho is part of surgery, so again, it's anatomy, so it's introduction. They won't be hard on you guys. Just make sure that you attend. Mostly it's about attending, and it's somehow how they're welcoming you now. And when you're doing final year, they'll be telling you don't have to worry about this. Fourth year welcome, it's still fresh babies and all that. Then they won't be putting much pressure on you. But when you get to fifth year, I'm telling you, you're going to be crying. So I think I did all of them, right? I did psych, I did ops, I did peds, I did combined, I did surgery. Did I forget any? Psych, peds. I'm sorry, guys. I don't have anything that I'm writing on, but it's 6 of them, right? It's combined, it's psych, it's peds, ops and gynae, surgery. What's the last one? Internal medicine, yeah. So I did all of them. So out of these, you only need the books that I think if you have the money, you can buy all the books. But if you don't have the books that you have to go buy, it's Obstetrics South Africa, it's Covadia, it's Internal Medicine, Kuma and Clark, and also or Devson, and also clinical examination. So you choose between Davidson or Kuma and Clark, but you need to have a clinical examination, tell your corner. So those are the books that you need. And there isn't really much of stress in fourth year. You just need to do your work. That's all I can say. Again, I'm not sure how they're going to examine you guys this year, but if you're going to do an online for this, not practice of medicine, for this CAMPATH and others, please make sure that you are doing it as a group. Again, I repeat, group work with online assessment helps. Don't go solo. Don't go solo with that. You're going to fail. So, but if you're going to come and write, because now COVID has subsided and all that, so you need to know your work. And in terms of practice of medicine, I know that it's confusing. It's a hella confusing because now you're going to the hospital, then you have to come attend. It's fourth year. It's one of a messed up year. That one I can say. Like, it's messed up. Adjustment is very difficult. But with time, now this is your first, second week. In the third week, you're going to be fine. You're going to be adjusting, but just know how to juggle around with that. So the best advice that I can say, again, I'll repeat this: get a final year. If you know any final year, then get close to them. They must share everything. If you are lazy, like one of my friends, so you cannot go there without a collecting format because it's new to you. You cannot go there and write a case without knowing the previous cases. So the person who did final year, fourth year, we're currently doing fifth year, can just send you, they say, this is the structure. So when you do your case, make sure that when you go type it to submission, This is how it is. If you're clerking a patient, you use this clerking format, this is how you present. So always, and the stuff, you're not always gonna wait for the lecturer to update the stuff online. So make sure that a fifth year that sends you those things, and you'll be good to go. So if there's any question, anything, let me know. I hope this will be beneficial. But again, get a final year, get a senior, then everything will be easy for you. So from me to you guys, please share, subscribe, and of course, comment for anything that you want me to discuss about. Cheers.